Well, thank you for that warm welcome, and thank you for the McCaig for having me here today. I'm going to go ahead and jump right into this presentation. So earlier, we heard from Dr. Billington on how to prevent bone loss and fractures. But what happens when we do have fractures? Today, I'm going to talk about two Alberta programs, Catch a Break and the Fracture Liaison service, that address our current osteoporosis care gap. How common are osteoporotic fragility fractures? Well, here are some fast facts from Osteoporosis Canada. Over 2 million Canadians are affected by osteoporosis. 1 in 3 women and 1 in 5 men will break a bone during their lifetime. Over 80% of all fractures are in persons over the age of 50 and are due to osteoporosis. 1 in 3 people who fracture their hip will refracture within a year. And unfortunately, there's a high mortality rate associated with hip fractures. We can see from this picture, osteoporotic fragility fractures are more common than heart attack, stroke, and breast cancer combined. Surely, a disease that affects so many would be well recognized and treated. Unfortunately, that is not the case. Around 80% of patients who have sustained a fragility fracture will neither be assessed nor treated. An 80% post-fracture osteoporosis care gap is in stark contrast to the excellent rates of care offered to patients after other serious events like heart attack and stroke. Fragility fractures are not benign. We can see the outcomes following a hip fracture are grim. Less than half will ever recover their full level of independence after breaking their hip. Close to 1 in 5 will need to be transferred to a long-term care. Sadly, 23% of women and 36% of men will die within that first year. Interestingly, most hip fracture patients already had a prior fracture. So you could call those warning fractures, and that people were warning us that they were at risk for more devastating fractures. Addressing fragility fractures is becoming increasingly important as our population ages. By 2046, 1 in 5 Albertans will be a senior. And as we saw in a previous slide, osteoporosis is one of the most common chronic diseases. Such we cannot afford to ignore it. You're likely asking yourself, why are we not recognizing and treating osteoporosis if it's so common and can have devastating effects? Great question. Some may characterize osteoporosis fracture care as the Bermuda Triangle. Although fracture patients are seen by many healthcare professionals, none of them are in a position to take responsibility for the underlying osteoporosis. The orthopedic surgeon's job is to fix the fracture, and this is done well. No one suspects osteoporosis, so they're not referred to a specialist. And patients are typically too busy running back and forth to the hospital and the CAS clinics that they're too busy to see their family doctor. And in fact, their family doctor may not even be aware that they had a fracture. The treatment gap is the lack of integration within the medical system, such there is no clear concept of who is responsible for the fracture patient. Thus, they are lost. The Bone and Joint and Strategic Clinical Network is closing care gaps by addressing the lack of integration within the healthcare system, connecting all the pieces of the puzzle so we understand the bigger picture in respect to comprehensive post-fracture care. The Fragility and Stability Program focuses on 4 main areas of fracture care. 2 programs that I'm going to talk about today that address the current osteoporosis care gap are the Catch a Break and the Fracture Liaison service. Catch a Break, or CAB, is a province-wide program initiated in 2014 by the Bone and Joint SCN and done in partnership with HealthLink to identify patients who've had a recent fragility fracture of the wrist, arm, spine, rib, and pelvis for the assessment and treatment of osteoporosis. CAB is a telephone-based service that facilitates communication between individuals and their family doctor about osteoporosis and treatment options to improve their bone health. Patients who are seen in emergency departments or in CAS clinics will be mailed a package introducing them to the CAB program and letting them know that they will be contacted by HealthLink for further bone health follow-up. Patients are also given information on osteoporosis, risk factors, diet, exercise, and calcium and vitamin D. HealthLink contacts patients by phone within a few weeks of their fracture. If a person's fracture is suspected to be fragility related, Patients are advised to complete follow-up with their family doctor if they have not already done so. If patients have not seen their family doctor, follow-up calls are done at 3 and 12 months to help remind patients of the importance of seeing their doctor to discuss their bone health, and they also encourage them to follow through on their doctor's recommendations. In 2019, CAB screened over 12,000 people after a fracture. 92% of those screened have visited their family doctor as a result of participating in the CAB program. This has resulted in an improved diagnosis of osteoporosis. Increases in identifying osteoporosis improves osteoporosis treatment. When looking at treatment numbers in Alberta before and after the initiation of the CAB program, with CAB, Alberta saw an increase in osteoporosis medication use from 5 to 43%. We also saw an increased use in calcium and vitamin D. By catching people early with their warning fractures and assessing, diagnosing, and promoting osteoporosis management, we can cut the risk of experiencing more fractures, hoping to prevent people from ever experiencing a hip fracture. But hip fractures do happen, and our second osteoporosis program, the Fracture Liaison service, seeks out these patients for osteoporosis treatment and falls management. The FLS is specific to hip fracture patients, as these are the highest risk patients in that their risk for another fracture is imminent. 1 in 3 people who fracture their hip will re-fracture within a year. The FLS is a dedicated team of RNs and doctors who identify patients who've been admitted to hospital with a high-risk hip fracture for the assessment and treatment of osteoporosis. The FLS RN meets with patients and family shortly after they are admitted to hospital, and the nurse completes a thorough assessment and bone health history. This information is reviewed with the FLS physician, and an individualized bone health care plan is developed for each patient. The patient and family are important members of the plan development, and this plan of care can encompass many things, including osteoporosis medications, fall prevention strategies, and any additional referrals that may be appropriate to the person's care. FLS nurses provide robust education to all hip fracture patients, tailored to their bone health needs. The FLS provides support to patients for up to a year after their hip fracture. Telephone follow-up is done every 3 months as needed for the subsequent year. This is where the nurse checks on how people are taking their osteoporosis medications, and if they're having any issues, the nurse and the patient troubleshoot these problems together. The nurse also asks about the person's mobility, falls, and if they're experiencing any problems in their recovery. Referrals are arranged as required to address any risks that were identified in the follow-up calls. Communication is a big part of FLS. We want a strong link between the hospital and the community. Patients get letters sent home with any important information about their bone health, and family doctors are kept updated with any relevant information throughout the year on their patient's bone health. And at a year's end, a summary is provided to the family doctor to help with the ongoing management of the person's bone health. There are currently 10 FLSs across Alberta in our major hip fracture hospitals. The first FLS was started by myself in 2015 at the Misericordia, and our most recent addition was the Chinook Regional Hospital in Lethbridge in 2019. Since its inception in 2015, FLS has assessed and provided bone health teaching to over 11,000 people and enrolled over 7,600 patients into the FLS. Now, not everyone who breaks their hip is enrolled. For example, if a person broke their hip from a major trauma event, like a car accident, they are provided information about bone health, but they're not enrolled as their mechanism for fracture is a little different than osteoporosis. But for those with high-risk fragility hip fractures, with FLS involvement, we got osteoporosis treatment numbers up to 52% that subsequent year. Now, we can't put everyone on osteoporosis medications. Some medicines are contraindicated for certain persons. Some people will refuse treatment, and other persons are at a palliative care level. But a 38% increase in treatment is impressive. And of all those enrolled into FLS, 98% are receiving appropriate management for their bone health. Oh, my phone went to sleep. Sorry. FLS has made a number of referrals to improve people's access to appropriate care to address any other underlying issues that may be contributing to their fall and fracture risk. Hip fractures are the most devastating fracture, and what is worse than breaking a hip? Breaking another hip. Thus, preventing future fractures is of utmost importance in this high-risk group, and Alberta is making a difference in reducing subsequent fracture risk. Again, by assessing and diagnosing osteoporosis, starting osteoporosis medications, and promoting other bone health practices and fall prevention strategies, we can significantly reduce the risk of future fractures for Albertans. And presumably, if we prevent future debilitating fractures, people will have better outcomes. An important thing I want to emphasize about CAB and FLS is they don't just move patients through care. Remember that Bermuda Triangle patient who was lost? CAB and FLS are meant to find those patients. These programs are the integrated models where health professionals are seeking people out to provide them with information and link them to appropriate care to promote their bone health. CAB and FLS are making a difference in the quality of life for thousands of Albertans by preventing debilitating fractures, by helping people make informed decisions about their bone health, and supporting people in being active members in their care. That concludes my presentation today. Thank you for all listening. For more information, you can check out the Bone and Joint SCN webpage as listed. I do also want to give a quick thank you to Osteoporosis Canada as they let me steal a lot of their slides for my presentation today, so thank you.